Good morning everyone. I'm Dr. Parvinder, Professor in Department of Orthodontics. Today I'm going to cover angles classification and what are the various modifications angle did. So in this I'm going to cover introduction, history, what is the need of classification and what are the various systems of classification. Like we have angles classification, we have ristures classification, we have canine and incisors classification. So now what do you understand by malocclusion? What is the definition for malocclusion? Malocclusion is anything or any variation or any deviation from normal occlusion. Now what is normal occlusion? A condition where there is a departure from the normal relation of teeth to another teeth in the same arch or to the teeth in the opposing arch. This is the most accepted definition of malocclusion. It is given by White and Gardner. So let's talk about little history of malocclusion, how this classification systems came into account and when this all is taken place. So Hippocrates included crooked teeth in his 6th book of epidemics as early in 24th centuries ago. So what we today call normal occlusion was described as early as 18th century by John Hunter. Carabelli in mid-19th century was probably the first person to describe any systemic way the abnormal relationship of upper and lower dental arches. So now the terms edge to edge or overbite are derived from the Carabelli system of classifications. Ewart Angle in 1899 introduced his classification of malocclusion. In this he has taken position of first permanent molar as a fixed position. Again then after this Simon in 1920 put forward a craniometric classification. In this type of classification he has divided dental arches in 3 planes: Frankfurt horizontal plane, orbital plane and mid-sagittal plane. According to him he has divided mid-sagittal, transverse and vertical. So he has taken account sagittal, transverse and vertical plane. All 3 planes are taken in the account, whereas in angles classification only anterior posterior discrepancies were taken into account. There is no account of vertical and transverse relationship. Then after his in 1969 Eckermann proposed a diagrammatic classification of malocclusion to overcome the limitations of angles classification. Now again he has divided this into 5 major characteristics, that is, first is the alignment in occlusion view, second is the profile and the soft tissue changes, third is the transverse plane deviation, fourth is the sagittal plane deviation and the fifth is the vertical plane deviation. So all these classifications has came into existence, but nowadays almost it's 100 years since Angle has introduced his method of classification. Then came so many modification, but in spite of all these, Angle's classification is still in use because of its simplicity in application. So this is the most accepted classification worldwide. So what is the need of classification? Why we need to classify malocclusion? What are the various important factors which are these are to identify the problem, to diagnose a problem. It is very important to classify something if we want to diagnose it for better treatment planning, for recalling, or for the purpose of comparison of one type of patient with another type of patient, or we have to give some reference or for communication purposes. So these are some important points which are needed. So that's why the classification of malocclusion has came into existence. So now malocclusion can broadly divide it into individual teeth. It can be in the same arch, it can be interarch or intra-arch, within the same arch or between the opposing arches, or it can be between the dental arches or between the skeletal malocclusions. Now we have dental malocclusions, skeletal malocclusion, individual tooth problems, or within the same arch or within the opposing arch, that is intra-arch and interarch. So now as we go into the depth of all this, let's learn about the basic terms. What are the different types of malocclusion and what are the basic terms have given. So when we say distal inclination or distal tipping, this refers to the condition where the crown of the tooth is tilted or inclined distally. So distal inclination or distal tipping means the crown tilted distally. So mesial inclination or mesial tipping means where the crown of tooth is tilted mesially. Again, lingual inclination or lingual tipping. Now there is an abnormal lingual or palatal tilting of the tooth. So this is also known as retroclination. Buccal inclination or buccal tipping. Again, this means that the crown is tipped in the labial or the buccal direction, or there is a tilting of the tooth, which is also known as proclination. Now we have a displacement. Whenever there is a bodily movement of the tooth, bodily movement of the tooth means the crown and the root, both parts of the tooth are moving in one direction. That is known as bodily movement or displacement. So mesial displacement means this refers to the tooth is bodily moved in a mesial direction towards midline. If we talk about distal displacement, this means bodily movement of the tooth in the distal direction, that is away from the midline. Lingual displacement is the displacement of the tooth in the lingual direction, that is full tooth movement or a bodily movement of a tooth in the lingual direction. Buccal displacement, this means that the tooth is displaced bodily or labially or buccally in buccal direction. Now let's talk about infraocclusion or supraocclusion. Infraocclusion is something when the tooth is not erupted up to the occlusal table, and supra is erupted beyond occlusion table. So infraocclusion, infraversion or supraversion or supraocclusion. Rotations is something when it means like the movement of the tooth around its long axis. It can be distolingual or mesolingual rotated, mesiolingual or distobuccal rotated. So these are rotations. Transposition is the term used when there is a condition when the two teeth exchange their positions. Example, when suppose on the place of first permanent molar canine come, and in the place of canine first premolar goes. So the two teeth interchange their position. So this term is known as transposition of teeth, transposition. So now let's talk about Engel's classification of system. So who has given this classification? Edwards Engel. He was the father of modern orthodontics. He has given this classification 1899. Engel's classification is still in use. It's almost 100 years of its introduction. It's used because it is very simple to understand, simple to communicate. So that's why this classification is used till date. So now what is the major key, what is the landmark, what is the basis of this classification? Engel classification was based on the mesiodistal relationship of teeth, dental arches and jaws. According to Engel's, maxillary first permanent molar is key to occlusion. He considered this teeth as a fixed anatomic landmark within the jaws. Based on this relationship of first permanent molar to lower permanent molar, he has given this classification into three types: class 1, class 2 and class 3 malocclusion. So he has given one is normal classification, normal occlusion. Normal occlusion means when the molar relationship in class 1 and in the anterior tooth there is no discrepancy, like no rotations, no spacing, no overjets, no overbite, no cross bites, no deep bites, nothing. Everything in proper position, but the molar has to be in class 1. That is class 1. Class 1 molar relationship means when the mesiobuccal cusp of upper first molar occludes with the buccal groove of the lower first permanent molar. So now next is class 1 malocclusion. Class 1 malocclusion means the molar relationship is again the mesiobuccal cusp of upper first molar occludes in the buccal groove of the lower first permanent molar. But in the anterior teeth we have crowding, spacing, deep bite, open bite, cross bite, any other malocclusion is present with molar class 1 relationship. Class 2 malocclusion is when the distobuccal cusp of upper first permanent molar occludes in the buccal groove of the lower first permanent molar. It can again have some problems. The incisors can be proclined, retroclined, deep bite, anything can be there. but the molar relationship is in class 2. So then we can write class 2 malocclusion. And lastly, we have class 3 malocclusion. Class 3 malocclusion, in this the upper first permanent molar occludes between the first and second permanent molar. And in the anterior region, again, it can be in crossbite, there is a crowding of lower incisors, proclination of upper incisors, anything can happen, but with the molars the relationship is only this. So now let's talk in detail what is Engel's classification. As we have discussed earlier, the upper first molar is in upper first molar class 1 relationship is known as when the mesiobuccal cusp of upper maxillary first permanent molar occludes in the buccal groove of mandible of first permanent molar. Engel's class 2, mesiobuccal cusp of upper first permanent molar occludes in the buccal groove of the lower first permanent molar. Now this classification is again divided into two parts, div 1 and div 2. Engel has subdivided class 2 malocclusion into div 1 and div 2. So div 1 classification means when the upper incisors are proclined. All the upper incisors are proclined, whereas in div 2 pattern the lower upper incisors are retroclined. Sometimes what happens, central incisors are retroclined and the lateral incisors are proclined, or all four central incisors, upper central incisors are retroclined and the canines are proclined. So this is the typical feature of class 2 retroclined, and class 1 div 1 is proclined. Engel class 3 malocclusion. Now again this is further divided into true class 3 and pseudo class 3. So here also the molar relationship is this: the upper first permanent molar occludes between the lower first and second permanent molar, and then it can be further divided into true class 3 or pseudo class 3. So what is true class 3? What are the causes? What are the etiology behind that? Usually true class 3 is because of genetic origin that can occur due to following reasons: maybe excessively large mandible, prognathic mandible, smaller than the normal maxilla size, or maybe the retroposition of maxilla, or combination of all the above reasons. And what are the peculiar typical features of true class 3 patients are? The lower incisors are tend to tip lingually, they are inclined lingually, or the patient can present normal overjet or in an edge to edge relationship, or maybe they are in anterior crossbite. Anterior crossbite means when the lower anteriors are ahead of upper anteriors. So this is known as crossbite. So now next is the pseudo class 3. Pseudo class 3 is also known as postural or habitual class 3 malocclusion. In this there is no deficiency in the underlying skeletal areas, but the problems, there is another problem is there. Like in some patients we have seen the presence of occlusal prematurities. They may deflect their mandible forward in order to maintain the contact, or maybe because of enlarged adenoids. So these are some causes. Because of that, patients tends to have pseudo class 3 relationship. So there is no problem in the underlying skeletal basis, but the problem is while positioning of their mandible when they close their mouth. So now class 3 classification can further subdivided. It can be also known as class 3 subdivision. In this we have class 3 molar relationship on one side and class 1 molar relationship on other side. Likewise also we have class 2 subdivision also. In that we have molar class 2 on one side and molar class 1 relationship on other side. So these are subdivisions. So now what are the drawbacks of Engel's classification? Why modifications have came into existence? What is the problem? So now the most important thing is that Engel consider malocclusion only in anterior posterior plane. He has not taken into account the vertical and transverse planes. Secondly, Engel considered first permanent molar as a fixed point in the skull, but this is not found to be so. Thirdly, if some patient come to you and his permanent first molar is missing or extracted, then what to do? Fourthly, the classification cannot apply to deciduous dentition, and the classification does not differentiate. It is a skeletal or dental. just by seeing the molar relationship, we cannot tell that it is a skeletal problem or a dental problem. We're just seeing the anterior posterior or the sagittal thing, and we can tell it is class 1, class 2 and class 3, but we are not able to differentiate it is skeletal or dental. Classification does not highlight the etiology, what is the cause of malocclusion, and in this, individual tooth malpositions have not been taken into account. So because of all these drawbacks, Dewey's modifications of Engel's malocclusion has came into existence. So Dewey was an early student of Engel's. Then he had a course in this Engel's school, and there he has divided Engel's classification into 5 types. Engel's class 1 into 5 types and Engel's class 3 into 3 types. So Engel's class 1 modification of Dewey's system was, type 1 was when we have class 1 malocclusion with crowded anterior teeth, that is type 1. Type 2 is class 1 malocclusion with protrusive or proclined maxillary central incisors. Type 3 is class 1 malocclusion with anterior crossbites. So we have molar class 1, but anteriors are in crossbite. Type 4, Engel's class 1 molar relation with posterior crossbite. Type 5, the permanent molar has drifted mesally due to early extraction of second deciduous molars or second premolars. So now he has further divided class 1 molar relationship into 5 categories, that is type 1, type 2, type 3, type 4 and type 5. And again class 3 malocclusion, where the molar relationship is that the upper first permanent molar is lying between lower first and second permanent molar. So molar relationship has to be there, that same only, but the modification, or they have taken into account the anterior malocclusion also. So in type 1, the upper and lower dental arches, when viewed separately, are in normal alignment, but when the arches are made to occlude, patient shows an edge to edge or an forwardly moved lower dental arch. Mandibular dental arch is forwardly moved, or they are in edge to edge bites, specifically for class 3 modification. Now type 2, mandibular incisors are crowded and are in lingual relation to maxillary incisors. Type 3, maxillary incisors are crowded and are in crossbite in relation to mandibular incisors. So they all have class 3 molar relationship with different anterior relationships of upper and lower arches. So now next is the Lister modification of Engel's classification. Now again Lister modified Engel's classification into various types. He substituted the term class 1, class 2, class 3 with class 1 as neutro-occlusions, class 2 as disto-occlusions, class 3 as mesio-occlusions. So he introduced the word vergence as a suffix to describe malpositions of individual teeth. So according to him, if we talk about buccal vergence, means buccally placed tooth or a group of teeth. Linguovergence means lingually placed teeth. Mesiovergence means mesially placed tooth or group of teeth. Distoversion means distally placed tooth. Supraversion, like the one tooth is supra-erupted, superiorly placed tooth in order to other teeth. Torivergence means rotation of tooth or other group of teeth. Transvergence means transposition of tooth, when two teeth have exchanged the positions. So these are various modifications of Engel's classification. Now let's talk quickly about the canine relationships. What are the canine classifications? Canine classifications are again class 1, class 2 and class 3. What do you mean by class 1 canine relationship? Class 1 canine relationship means when the mesial margin of upper canine coincides with the distal margin of the lower canine. Class 2 is the distal margin of upper canine coincides with the mesial margin of the lower canine. And class 3, when the mesial shape, that is the mesial margin of upper canine coincides with the distal margin of lower first permanent premolar. So these are various classification and various modification which I have taken into account, and the still most accepted classification is the Engel's classification. No matter it has so many drawbacks, but still it is the most accepted classification worldwide, and it is very because of its simplicity and easy to communicate. Thank you.